Pharmacy exam multiple choice questions with their answers. To prepare a total parenteral nutrition, that is TPN, that requires 10 milliequivalent of calcium gluconate and 15 millimoles of potassium phosphate, the appropriate action to take would be which of the following? Options are add the calcium first, add the other additives, then add the phosphate last, thoroughly mixing the solution after addition. Next option is add the calcium gluconate and potassium phosphate consecutively. Third option is do not combine the agents together but give them as a separate infusion. And the last one is none of the above. So here the correct answer is option A. This is because physical incompatibilities occur when two or more products are combined and produce a change in the appearance of the solution, such as the formation of a precipitate. Calcium and phosphate solutions, when directly combined or added consecutively to a solution, will form a white precipitate. By altering the order of mixing, they can be safely added to TPN solution. So hence came the answer as option A, that is add the calcium first, then add the other additives, then add the phosphate last, thoroughly mixing the solution after addition. Which needle gauge would be most likely used as a subcutaneous injection of epoetin? Options are 25 gauge 5 by 8 inch, 16 gauge 1 inch, 18 gauge 1.5 inches, 22 gauge 1.5 inches. Then none of the above. So the answer is option A, that is 25 gauge 5 by 8 inch. Because subcutaneous injection does not require penetration through several skin layers or muscle tissue, a short needle with a narrow diameter is used. A 16 or 18 gauge needle is most commonly used in the pharmacy for preparing parenteral solutions. A 22 gauge needle would be used for intramuscular injection. Which of the following compounded sterile products should not be prepared in a horizontal laminar flow hood? Options are total parenteral nutrition, dopamine, cisplatin, nitroglycerin, beryllium tosylate. Here the correct answer is option C, that is cisplatin. Cisplatin is an anti-neoplastic agent and consequently should be prepared only in a vertical laminar flow hood because of the potential hazard of these toxic agents to the operator. All of the following statements about D5W, that is dextrose 5%, are true except options are its pH range is 3.5 to 6.5, it is hypertonic, it is a 5% solution of D-glucose, it should be used with caution in diabetic patients, it is often used in IV admixtures. So here we need to find out the statement which is wrong about this dextrose 5%. So the wrong statement is option B, that is it is hypertonic. This dextrose 5%, it is dextrose, that is D-glucose 5% in water, is acidic. Its pH ranges from 3.5 to 6.5 and it is isotonic. It is often used in IV admixtures and should be used with caution in diabetic patients. All of the following are potential hazards of parenteral therapy except options are hypothermia, phlebitis, extravasation, allergic reactions, ileus. Correct answer is option E, that is ileus. Parenteral therapy is often a treatment for ileus. Hypothermia, phlebitis, extravasation, and allergic reactions can be hazards of parenteral therapy.